Moving on to the bony or osseous structures of the wrist, we are going to be moving down on each side of the wrist. When discussing the wrist, a lot of times we will avoid saying lateral and medial and anterior and posterior. We will more say radial, being the thumb side, ulnar, being the pinky side. The posterior side referring to the dorsal aspect of the hand and wrist, the palmar side being the anterior aspect of the hand and wrist. So using that terminology, we will start moving from the mid shaft of the radius and ulna, coming down until we feel on the radial side, the thumb side, the most distal aspect of the radius called the radial styloid process. From that point, we will move dorsally until we feel on the lateral, still on the radius, on the lateral side, a bump. That bump on the dorsal side of the radius, sometimes called the dorsal tubercle of the radius, is also called Lister's tubercle, in which the extensor pollicis longus runs. From that point, we will continue to move to the ulnar side, and most people can see just resting a prominent structure right there. If you cannot see it, run down the ulnar side of the forearm until we reach this bump, and that is the head. This whole thing is the head of the ulna. On the far ulnar side, coming as distal as we can, we will feel a little point, and that point being the ulnar styloid process. Coming back to the radius, with the hand in the mid-pronated supinated position, we are going to go to the radial styloid and into the snuff box, the anatomical snuff box, which is made up of the abductor pollicis longus, extensor pollicis brevis, let's run right next to each other, and the extensor pollicis longus. In that snuff box, we will place a palpation finger, and with ulnar deviation, we will actually move that scaphoid bone into our palpation finger. So palpating the scaphoid, we locate the styloid process of the radius, place our palpation finger in the snuff box, and then ulnarly deviate. When we radially deviate, that bone should disappear, that scaphoid should disappear. So the scaphoid pops out, the scaphoid disappears. We also want to be able to palpate the scaphoid on both the dorsal side and the palmar side. It's most important on the palmar side because there will be a tubercle in which is one of the 4 pillars of the carpal tunnel, which will be important in treating carpal tunnel syndrome later on in the quarters to come. So the tubercle will be palpated when we grab on each side. There's a bump on our distal wrist crease, or proximal wrist crease, and there is a nice big bump there. Going from the scaphoid to the dorsal side, we find the distal end of the radius, and we find at the very distal end of the radius, we drop off into the wrist, and there are some tendons there, but we can move the wrist around and see that we are completely off of the radius and onto the scaphoid. Going from the scaphoid to the lunate. The lunate is the next one going in the ulnar direction. We can palpate that on both sides because of the carpal tunnel and the tendons that run on the palmar aspect of the wrist. It is hard to palpate on the palmar side, but more easily palpated on the dorsal side. And we go between the 2 bones of the radius and the ulnar head, but right between those 2 bones. And when we flex and extend our wrist, we will feel it pop into our hand and then disappear. Pop into our hand and then disappear. Pop into our hand and disappear. From that point, going further to the ulnar border, we will go just distal to the head of the radius, being in our obvious bony landmark. Make that head of the ulna. go distal to the head of the ulna, and on this one, on one side, we will palpate the triquetrum, and on the other side, we will palpate the pisiform. So on the dorsal side, just distal to the head of the ulna, we will be palpating the triquetrum. On the palmar side, we will actually be palpating the pisiform. So we are actually palpating two bones at the same time because the pisiform sits on top or just anterior to the triquetrum. Moving back across to the thumb side, we go to the distal row of carpal bones, starting with the trapezium. The trapezium we will palpate on each side of the thumb. So our thumb moves freely, or our first metacarpal bone, and we will use that as an obvious bony landmark. Following that to the base of the first metacarpal, we will drop off that base and palpate that bone, and then move the first metacarpal or thumb, and to make sure that we are off of the thumb, and then we know we are on the trapezium. This is called the trapezium a lot of times because the thumb swings on the trapeze or trapezium. The next one, the trapezoid, is difficult to feel palmarly. It is more easily palpated dorsally, and our bony landmark will be the base or proximal end of the second metacarpal. So we palpate the second metacarpal to its base, and when we first come off of that base, we will palpate a little bit deeper a small, tiny bone, and this one is harder to palpate of the wrist bones, but that is the trapezoid. Moving in the ulnar direction again, going to the base of the third metacarpal will be the capitate. This is a large flat bone, the largest bone of the carpal bones. So we find the third metacarpal and palpate down to its base and drop off into a little divot. That divot will disappear and the capitate will pop into your palpation finger with wrist flexion. It will disappear as we extend the wrist. So it appears, disappears, appears, disappears. The last bone approximates with the last two fingers and is the hamate. Palpated on the dorsal side is sometimes necessary, but we'll be more concerned with the hook of the hamate, which is on the palmar side. The obvious bony landmarks, of course, will be our fourth and fifth metacarpals. Palpate them to the bases, come off of those bones, and we are on the hamate. If we're palpating on both sides, you can actually palpate the hook of the hamate on the palmar side. So switching hands, we will actually be palpating the, whoopsie, I'm a little bit off, the hamate and the hook of the hamate. Now, we're going to switch hands so you can see this a little bit better in this angle. The hook of the hamate, the bony landmark will be the pisiform. If we come across at an angle towards the index finger, about 1 finger width, boom, we will palpate a little bit deeper, and you will feel a bony prominent structure, and that is the hook of the hamate. So we have actually palpated the hook of the hamate and the pisiform, which make up the ulnar pillars of the carpal tunnel. We have palpated the tubercle